AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for our Focus on Seniors, helping seniors. I get there in too many radio shows, John, over the years with you. I forget. It's helping seniors, folks. That's the right one. And the purpose of our program is to inform, to educate, and to connect seniors and those that care for seniors with resources. Our information specialist, Kay Kaiser, can be reached by calling 473-7770, or you can reach us by calling radio station AM 1060, which is 241-1060, 241-1060. You know, and we have sponsors that help us do the many things we do, and so it's getting more and more exciting because I've been doing this work now for 20-some years, and I see opportunities opening up in Brevard County for senior programs, say better ways to inform people. And one of the biggest tasks we have is finding a way to pay for all this. I'll be honest with you. Sponsors are what keeps us going. We have people that make grants, we have foundations, but we try to earn our own way through doing a really good job of informing you through television, through radio, and through the printed media. And some of our sponsors include Kindred in Kind Home Health Care, the Eye Institute, I keep saying Solid Body. It's really just Dr. Lee Sheldon, dentist. Bill Johnson, elder attorney. This radio station, WMEL, AM 1060. Woodstock Hospital Systems, 11 Home Care, Atlantic Shores, Ebony News Today, and Wendy Handy from the Dale Sorensen Real Estate. But it's all exciting. And what is exciting about it is that every time I think we've exhausted our source for finding people that really want to help other people, we keep turning up new resources. And one of the people that does a lot to help people in Brevard County is a lady by the name of Sherryl Worst. And Sherryl started a program called Smile Angel Foundation. Carol, welcome to the show today.
Thank you so much for having us.
You're quite welcome, and welcome to you, Kay.
Thank you.
Yeah, I think it's important, folks, that you all listen to what Sherryl has to say and what Kay is going to say that she's been finding out, and we're going to use some examples on the first part of the show to show why having organizations like Helping Seniors is so important. But first of all, Sherryl, what is the Angel or the Smile Angel Foundation? What is it?
The Smile Angel Foundation is committed to improving the oral health and overall well-being of all individuals less fortunate through dental health hygiene, supplies, education, and financial assistance when needed.
But why did you start it?
Well, I've been in the business field. I've owned a dental laboratory, so I have fabricated hundreds of thousands of dentures over 20 years here in Brevard County. So I definitely know the need to be able to have a proactive approach with our community so we don't get to the point of dentures anymore. So I used to volunteer within the community, working with Toys for Tots and several other nonprofits, and one day I decided, why not do what I know best? And so that next morning I woke up and incorporated at the 501c3 nonprofit public charity Smile Angel Foundation.
I think it was interesting that you brought that out because you sent me a piece of paper and it had 5 statistics on it. And one of those statistics was the fact, and I'm going to read it, 1 in 4 Medicare beneficiaries, 1 in 4 now, 1 in 4 have no natural teeth. How can you explain that? And, you know, if I say 1 in 4 Medicare, that means I'm talking about almost all seniors are on Medicare.
Correct.
Are you saying that 1 out of 4 seniors in Brevard County does not have their natural teeth?
We are gaining in that. This was a statistics done by the Kaiser Family Foundation about 3 years ago. Because of the boomers that are coming up, we are getting more elderly with actually more teeth, but we're still at the 1 in 4 Medicaid beneficiaries. So not all seniors, those that are on Medicaid. So, and unfortunately, Medicaid doesn't cover all oral health issues.
Okay,
and
you're saying Medicare now.
Yeah, this is Medicare. Mm-hmm.
Medicare. Because I think it's, if people are hearing us, I don't want you, our listeners, to think we're talking about Medicaid. We're not. Medicaid is a long-term health care program. Medicare covers medical needs. And so it's extremely important that you stay on track with what we're talking about today. I found it very difficult to believe because when Sherryl made her opening comment about improving the health of everybody, I know Dr. Sheldon and I have done so many television shows where we talked about a whole dental approach to improving dental care through the use of the right kinds of foods, use the right kind of nutrients. And there's so many things that affect your body care when you're talking about dental care, Sherryl.
Correct.
And I wasn't aware of the fact that you make teeth. I didn't know that.
Yeah, I've done that for over 20 years. Fabricated dentures.
But, you know, you started the foundation. Do you find that you get other dentists to help support? How do you make it work?
Right. Well, we're learning. We learn a new approach every month. It is engaging the dental profession, our dentists, our pediatricians, our orthodontists, and engaging them to help with the clients that come in through the Smile Angel Foundation. So we get the clients, and then I start making phone calls. And I started with making the phone calls to those dental professionals that I worked with in the past. And we do look for pro bono, but we also look for professional discounts as well, because I myself, being a business owner, we're not out to try to get everything for free from the dental professionals. We want to be able to pay them something, and that's why we do special events, and we try to raise money on our own too. We would love for all patients that come in to get free dental care, but that's just not going to happen.
Have you been able to raise money to help offset some of the expenses?
We do, actually, yeah. And with the Smile Angel Foundation, there is no payroll. 100% of all monies donated or through grants goes directly into the community. So whether that is with cleaning at the college with the student hygienists, whether it be a pro bono situation and we pay for the gas and even food. We've taken a couple of veterans all the way to Tampa. We had a doctor who's a veteran, wanted to be able to help the foundation, and so he took 2 veterans on, and I personally drove them to Tampa, and they got their teeth extracted and their dentures, and I fed them lunch and brought them back home. And these were homeless veterans that we took care of.
And the veterans on the hospital did that over in Tampa?
A dentist in Tampa. Mm-hmm.
How long did it take you to set something like that up?
That was luckily just a phone call, and then probably about 2 weeks of coordinating a schedule between the patient, myself, and the dental office. So
if Helping Seniors is able to take this 1992 XJS V12 Jaguar that we have, that we're looking for a car dealer right now to be our sponsor so that we start selling tickets on this thing. If we put money into an endowment and say we start off with $200,000 in endowment at the end of the first year, and we decide we're going to take 10% of that every year, and $6,000, $7,000, or $8,000 was given to you to help you do this dental work throughout the whole county for people that couldn't afford it, would that make a very significant impact on the work that you're doing?
I'm going to start crying because money is so important to us, because dental is expensive. Yes. So we have amazing dental professionals that do pro bono work, but it could be anywhere from nothing to almost $2,000 a patient, depending upon what their need is. There are some dental groups that just provide, have us pay for the dentures, which is the labs cost for the dentures, and then there's others that have us pay for the extractions and other needs, whether it be a scrape or a bone scrape situation, which is anywhere from $1,800 to $2,000, and they take care of the dentures. So we never know going in when we get a patient how much that's going to cost. So,
but the thing here is that no matter what we say, the fact that you've started this has given you some insight, and the dentist that you get to help you, where they might charge $1,000, if somebody else went in and got the same work done, we're talking $3,000 or $4,000 or $5,000.
Correct. We have it's amazing. Yeah. So $8,000 could take care of anywhere from 10 to 30, 35, even 45. We just never know patients with that money. So
what it amounts to, and with your foundation, by judicious use of the monies that you have allocated to you, and knowing the people through your connections and your work, you're able to make the money go farther, be more cost effective, and you're able to serve more people.
Correct. We stretch it as far as we can.
Yep. Do you get a lot of calls? I
get anywhere from 2 to 5 calls a week. As a matter of fact, we got a phone call from the same gentleman this week.
So you're going to get more calls since you...
And I'll be getting more after this.
You can count on that.
It's fair to talk about this because, most people don't know. I'm just going to read a couple of statistics, folks. Mm-hmm. I think it's important for the listeners to know this. I said that, Medicare does not provide coverage for routine dental care. Some beneficiaries have dental coverage through private plans or through Medicaid. But the Medicaid, when help comes through Medicaid, folks, is because they're disabled people, generally speaking.
Correct.
And they have a problem. So while we say Medicaid is for long-term health care, there are some ways that it can be used to pay for medical and dental aspects. And that's why it's so important to go to a counselor. And that's why we tell people, and we're going to talk about it later on the show, and to remind me to talk about the VA people getting help and care through different ways.
Okay.
But I think it's also important that nearly half of all Medicare beneficiaries have had no dental visit in the past year, and 22% report they have not seen a dental provider in the last 5 years. I thought that was an interesting statistic, but the last one here is, I thought it sort of blew my mind. Medicare beneficiaries who used any dental services in 2008, you can see, folks, the statistics are old, in 2008 spent on the average $672 out of pocket for dental care. Now, that might not sound like a lot of money to you, but a guy named Peter Brooks down in Palm Bay, who monitors almost everything that's going on in the medical world today, and he sends me some important stuff. He sent me one on debt, and I'm going to read some of the statistics in the later part of the show about what we're finding out with senior citizens and amount of money they spend, the amount of debt that they have. The important thing is that all these costs are going up, and nothing is getting cheaper. There are less monies available to help people. Fewer people are able to pay the increasing cost of maintaining themselves above board with debt. We're finding that more and more senior citizens are selling their homes and renting because they can't afford the insurance and other costs with maintaining a home. So what we're doing is we're reversing the process of the last 100 years with what we've started in the United States. And while, it may not be happening to you or your immediate circle. It is happening in the United States, and that's what we try to get this point across in these radio talk shows. I listen to the radio talk show hosts on national television, Laura Ingraham and some of these other people. I listen to them and what they have to say, and they bring facts right out in the bare open that are eye-openers that most of us don't know anything about. I think I remember years ago, John Harper's operating a board today, and John talked to me about the value of radio information. And I said something to John 20 years ago. I said, well, John, do you think radio is going to be around? And he said, radio is here to stay, regardless of what people say. There's always going to be a need for radio because radio is a source of information, and we're realizing more and more that more people are finding out about it. Had it not been for this radio show, Cheryl, I never would have known about what you do because Kay heard about it. She talked about it. She knew we needed to talk about it on the radio show. Yeah. So more and more. What else can you tell us about the Angel Smile Foundation? Why is it so important for people to know about what you do, Kay?
We're doing our best to educate. It seems that more and more as the years progress, dental is kind of on the back burner, whether it be with parents educating and making their children get in the bathroom and brush 2 times a day and floss and getting them to understand the importance. And our VA, unfortunately, doesn't have the ability to be able to take care of some patients because of that.
Okay.
I wanted to make a comment on that because I had a fellow who was a veteran who called me the other day. He was trying to get dental care at the VA clinic. He gets his medications there and everything. Right. However, he was declined for his dental work because it was not service related.
Correct.
So I want you to comment on that, Cheryl. A lot of people think just because they're going to the VA clinic, they can get all the different services available to them as a result of being a veteran. But I know that you personally have had a lot more experience in dealing with that, haven't you?
We
do. Cheryl.
We do. We get a lot of calls from the VA, from the counselors there, and we have provided them with information to be able to provide to their patients because it's not covered. If they have a toothache, if they need dentures, they could have half their teeth have been extracted for one reason or another, but there's nothing to help replace that denture, and that's where we come in. That's how we started this foundation because we want to be able to replace those missing teeth with dentures and acrylic partials. We can't afford the metal partials, but we do take care of it with acrylic partials because they deserve to be able to have a healthy smile as well. Plus, it helps with their nutrition. Sure. If they don't have the ability to eat properly because they're sore, their teeth are loose, or whatever the case may be, then their nutrition levels fall. So then it becomes a medical issue.
Well, Joe, we went back several months ago, more than a year ago, I believe now, that we had a veteran who was eating just baby food because he needed his dentures replaced so badly. So obviously he wasn't getting the maximum amount of nutrition. He wasn't eating right. It was painful for him. Mm-hmm. So, Joe, what happened to that story with this fellow?
Well, the board of directors chipped in about the guy's set of teeth because we didn't have the endowment yet. We didn't have the capability. We were just getting started. And but almost everything we do in a nonprofit world is based on the charity of other people. Not just charity, but an understanding of people that good things don't happen unless you make them happen. Like John Harper donates the time for this radio show 1 day a week, 52 weeks out of the year, to promote all these good things to help people. It's great to have programs like Aging Matters and the Brevard Alzheimer's Foundation and the Alzheimer's Disease Initiative, and it puts people in daycare and the respite care programs and all the other nonprofits that exist. But those two are the ones that get most of the federal and state dollars to help people. So people outside of a small group that are already receiving care need to know that these monies are available so that so that we can really establish a true need. You know, how do you really know how much of a need exists in a community if you don't bring the problems to the fore? And that's what I think that talk radio does. Our radio and television shows and our newspaper articles try to address the true need that exists in a community. And it's people like Peter Brooks down in Palm Bay that monitor all the stuff that's happening. And he sends me these emails, and one of them had to do with health care. And I know that Dr. Sheldon had already started a new practice in his dentistry, which we did a show on television called Inclusive Dentistry, which exemplified the importance of periodontal care. And that's something that you were addressing. You didn't use the word periodontal care, but I knew that's what you were talking about.
Correct.
Can you address that?
I have to choose my words wisely because, one, I am not a medical or dental doctor. I am just, so I don't want anybody out there thinking that I am. But absolutely. And Dr. Sheldon is amazing. And so is our Brevard County Dental Hygiene Association. They support the foundation 100%, and we get a lot of volunteers through that to help us out.
We're getting a signal. We're going to take a mid-show break, folks. Stay with us. On the other side, we got a bunch of stuff we're going to talk about, something you need to know about, something we picked up information on. Stay with us.
Nominated Business of the Year by the Cocoa Beach Regional Chamber of Commerce. This is AM 1060 WMEL.
This is Joe Steckler, folks. We're back live with the second half of Helping Seniors, a radio show designed to inform, educate, and connect seniors and those that care for seniors with resources that seniors need. Our information specialist, Kay Kaiser, can be reached at 473-7770, or you can call the radio station here at WMEL AM 1060, 241-1060, 241-1060. The sponsors for the second part of the show include Senior Scene Magazine, Hometown News, Spotlight Magazines, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney of the Brazel Courtney Financial Team, Barbara McIntyre from Home Equity Loan Specialist, the Canadian Meds of Melbourne, and Vitas Hospice. And I got one more. I can't remember. It's the...
Ear care?
Ear care. I forgot it. You got ear care. And that's something I should think about because, I have trouble with my glasses and I have trouble with my ears. So I should remember that. In fact, I went in to get my hearing aids fixed, and I didn't realize I was trying to sell these people sponsorship, and they already were sponsors. It was ear care. That's how nice people were there. So, you learn a lot by just going in someplace. And I do want to thank Sherryl Worst for her work with the Angel Smile Foundation because...
Thank you.
It's so important, Cheryl, what you do. And she's going to be here, and she's going to be chip in on the second part of the show. But one thing I want to remind people of that when you get your medication, there's a piece of paper usually comes with all the medications. You really, really need to read this stuff, folks. I take a lot of medication, and sometimes I have a hard time reading the fine print, and I ask my wife to read it. But it's important that whether you do it yourself or you got somebody who reads it for you, that you understand it. I read the law website a lot. It's called the National Association of Elder Law Attorneys. And they have a thing they put it out every week, and Bill Johnson sends it to me. And they're generally 12 to 14 pieces of important information. And a couple of things came up this time were what they call proton pump inhibitors. And it sounds like you got a piece of equipment pumping on you. It's not what it is at all. It's some of the drugs we take for stomach acids. One of them is Prodosec, another is the purple pill, Nexium, and there's a couple of other ones. I cannot give out medical information because I'm not a doctor, but I can advise you to read stuff because there is information coming out through some of the research networks that come out through the Kaiser Foundation and come out through some of the research done in Germany that indicates that there might be dementia associated with some ways that these pills are used for seniors. So all I'm saying to you is do a better job of reading the fine print about all medications that you take. It might be extremely important. But for the last part of the show today, Kay and I want to talk about some personal situations that we developed through the contacts that we make through our calls that come into the office to the information specialists. And a lot of them involve early stages of the needs for guardianship, why it's so important for all of us to be aware of the importance of family squabbles and the fact that as we get older, we need to do a better job of ensuring that our family truly understands what it is that we want and what we don't want. That's so important. And Kay, perhaps you can elucidate a little bit on that because of some of the personal calls.
Well, it takes a lot of guts. I'm going to put it in that context for a caller to call and say, I'm concerned about my neighbor, because there's a problem going on with, and I had this call just as recent as yesterday. He's concerned because his neighbor, 88 years old, fell, broke his hip, was in the hospital, was put into a rehab, and literally the son and daughter forced this man to sign documents and was sent to the rehab with only $1 in his pocket. And he wanted to actually go to another skilled nursing because he can't even get his own regular doctors to visit him. So this poor fellow is in the rehab, and the family, son and daughter, have come in and basically wiped him out. So it's an elder abuse situation. So just my tears come to my eyes when I hear stories like this of the family, taking advantage of her mom or dad just because they've gone ill or something's happened. It's just not right. And yet it's happening so often. And I told callers, I told this fellow yesterday, I said, well, here's several resources I want you to call, including Laura Moody, our assistant attorney here in Viera, and explain. You don't even have to say your name or anything, but these things need to be brought out. I had another lady just as recent as last week call. The same thing. Her husband is in a skilled nursing, and a result that the husband's son is now the durable power of attorney, and the daughter, and they've made it extremely difficult on this lady to see her own husband. She went on and she was crying on the phone with me and telling me that, she can't even go and see her own husband because the kids actually yell at her in front of everybody. So she's very intimidated and very embarrassed. And it's just a shame that these things have to go on where the children are now taking advantage of their mom or dad.
One thing you failed to point out that this involves a second marriage.
Well, that's true on that one.
And this is a point that Bill Johnson and I have delivered this on our radio and television shows over the years. And no matter how much we talk about it, folks, these problems with second marriages and third marriages are going to continue to come up. Yeah. And unless the spouse and the spouse involved in the second or third marriage puts the correct paperwork in place early on in their marriage, you're going to potentially be faced with problems like this. But there are documents that you can go and, as much as you hate to even think it, children do unfairly involve themselves in a second marriage situation, thinking. I like to think two things: thinking they're doing right, and that's not always the right thing. But more importantly, they get involved because they want to protect the assets that they think should come to them. Right. And that's a bold statement to make, but it is the truth. And unfortunately, that's so important, Kay. And we're finding this out more and more with phone calls. The same thing with many of the phone calls we get on the Veterans Administration. We find a lot of good things, but folks, I want I want all of our veterans, and there are 67 to 75,000 of us here in Brevard County, plus all the unmarried or unremarried widows of people who served in World War II in Korea and Vietnam that are entitled to benefits. And you just can't take a bold figure and say, well, I know that I make $1,400 or $1,500 or $1,600 a month, and that puts me over the limit for getting the additional VA benefits that could be as much as $1,400. Folks, it's not true. What you have to do is talk to a veterans counselor,
right?
Because there are so many ways that they can adjudicate your assets, and this is where a good elder law attorney comes in, and this is why the government put these programs in place, because they knew that situations like this were going to come up. And as much as I hate to admit it, there are some things in the Affordable Health Care Act that we're finding out now that were purported to be bad things. They're not bad things. They're really not. There are some good things. And one of the things is we all know that the cost of health care is rising.
Right.
There's a system that they have called telepathy, and it's a system that one of the biggest calls that emergency rooms get involve patients coming in from nursing homes. In a nursing home, if a patient has a problem, there's a doctor there, there's a nurse, and they think that the patient needs to go to the emergency room. They pull the plug and they call and get an ambulance there, and all these costs are invoked when, in fact, they have a system that they're using now, and Woodstock is really trying to do this through their emergency rooms, where they can connect the doctor to the patient in the nursing home so that the doctor can actually listen to the heartbeat, listen to watch the signs from an EKG, and do all this over television, over his phone, and he can decide whether or not that person needs to go to emergency care. And in many cases, it's not necessary.
Look at the costs that are going to be solved by this.
Yeah.
Oh my gosh.
Yeah. We have this is one thing. This is one thing that the hospitals can do. And just to show you how important it is, there were $157 million allocated to put 44 sites in place throughout the United States that could take advantage of systems like this and new technologies so that you could connect medical needs with social needs. And Gustav has asked us, helping seniors, to be a partner in a $5.7 million track for on hospital alignment that involves awareness, connection, and alignment. It's a big thing. It involves emergency rooms, but where the awareness part comes in is like this radio show.
Exactly.
This radio show becomes one of the partners in trying to make all of us aware of new technologies that emergency rooms can use to help drive down the cost of care. We say that we cannot drive down the cost of care. That's not true. We can, through the correct use of a lot of technology and making up our minds that we can use these systems, we can do a lot better, Kay.
Oh, absolutely.
And
it's going to even get better, I think, once the technology has been proven and used and so forth, and was like Woolsoft can prove how much it's saved over a period of time for those non-hospital emergency people coming in. It would be absolutely mind-blowing to see where that future is going to go, Joe. I'm excited about that one.
Yeah, I agree with that, because one of their biggest issues, one of the highest percentages, is people going to the emergency room for dental situations, whether they're in pain, extractions, infections, and so on. So it's a huge situation that the emergency rooms
let's just talk about it a second. That's one of the biggest things that's come out in a national study, that so many people, when you're hurting, you go to emergency room because generally speaking, these things occur after a doctor's office is closed. People don't have primary care doctors. And the same if you've got a toothache, the same as any other ache in the body.
Correct.
It can drive you crazy.
Correct.
With the intensity of the pain. So you go to the emergency room.
Right. And most
doctors,
hospitals.
No dentist there.
No. I don't know how many. I don't know the percentage, but most do not have a dental professional on staff. It's on call. One of the things that Jess Parrish is doing is the Health Alliance mobile unit comes in and parks in their parking lot because they have such an overwhelming
But that's
amount.
a rarity.
Yeah,
it's a
very
rarity.
rare.
A rarity.
Correct.
What the emergency room doctor can do is he can give you something for pain, and he sends you home, and if he gives you enough to control the pain so he can get to a dentist on a Monday or so.
And that's rare, too. The pain medication, normally it is a antibiotic for an infection and not because there are some that continually go to get the pain medication. So, one that is in pain may not get what they really need.
Okay.
And then they don't, there's never follow-up. They get that, infection taken care of. They think they're not in any more pain, so then they don't do a follow-up with the dentist. And then they're back in the emergency room in a couple of months, if not within 30 days.
Okay, let's talk about something else. We didn't have this on the show to talk about. I think you two can answer the question. Let's take the emergency room out of the equation and throw the urgent care centers in. And can the urgent care centers do anything to help people that have tooth problems?
The same as the emergency rooms, just to take care of the infection. Maybe some pain medications. I'm not sure. I don't know how far they go with that, but it's really just sending them on. I mean, they don't do extractions or anything like that. So.
And I haven't seen them actually have any dentist on their staffs either.
Right.
Am I correct on that?
Correct.
Yeah.
Mm-hmm. So that's what we're trying to do with the Smile Angel Foundation is get out there and try to decrease those numbers. So we're looking for support from the hospitals because the more we engage with the community and help build their oral health habits up, and less decay, less tooth loss, we're actually a bigger part of the equation, making a healthier community.
And again, it's going to save a lot of cost
and lives.
Yeah, it's interesting because my dentist, before he became a dentist, was an emergency room medical doctor. So,
wow.
and we discussed this type of option and the care system, and all the things that we probably could do better if we had the doctors and the dentist and the money.
Correct.
Make it all happen.
Money is everything, right?
It is.
Yeah,
Unfortunately.
it is.
Unfortunately.
But,
and quite frankly, the majority, for those listening to today's program, the majority of calls that I do get, unfortunately, are from low-income seniors. Mm-hmm. And that, reaching out, they don't have a computer at home. They don't get the newspaper. They don't have a way to find out and navigate the system. But the most part is they're looking for help. And that's what Helping Seniors of Brevard is all about. And I'm blessed the fact that I found that Sherryl here with her nonprofit, because I know that it's just, we keep building. I keep building more resources every day. Mm-hmm. And the bottom line is, and I tell my callers, if I don't know the answers, I typically will call Joe and share some stories with you too. But
I think
we'll research it.
I think that one of the things that we've been able to establish, Kay, is that whether we like it or not, people need to understand that there are many types of abuse, and that it's not just somebody getting slugged and having a black eye that is the recipient of the older abuse. It's financial abuse. It's taking your money away from you. It's taking things away from you that makes you non-mobile. It's keeping you from seeing your family and friends. And
if I could, Joe, I'd like to share a short story. I won't read it all, but I'll just kind of touch on it because I had a call about 3 weeks ago from a woman, or actually a month ago, who is visiting in Virginia. She's due back to Brevard any time now. but became friends with this lady that she found out that she was put in a lockdown Alzheimer's unit because she had given to her sister the durable power of attorney because she was going to go into for a brain tumor and the chances of survival were slim. Well, she did make it out okay, but her sister put her in this lockdown, and this poor, I'll just call her Libby without her last name, but Libby wanted to try to help this poor woman so badly. And, she was reaching out saying she really didn't want to be there and everything. And because Libby had called even an ombudsman, the sister decided that she was meddling too much in her business. So would not let her sister even have any visitors at all. Not to mention no mail, no nothing, just cut off from the outside world. So,
and this was in Virginia.
This was in Virginia.
Right.
Put her out. So there'll be an article in March issue of Senior Scene magazine that Libby has provided us. Would your power of attorney want the best for you? So it goes along with everything else you've talked about too, Joe, and the fact that looking after the guardianship when you discussions with Bill Johnson and
right.
making sure that everything is in order because you don't want to have a family member have to go through these kind of situations.
Well, what was interesting was that Libby asked us if we could do any research to see if there's any kind of a law here. We're about out of time? 2 minutes. Okay, I can tell this real quick. Libby asked if there was any kind of a law in place in Florida that would prevent something like this happening in Florida that's happening in Virginia.
Right.
I started doing some research and I pulled something up and showed over in Arkansas they have a requirement that if a person's in a nursing home that in order to establish a guardianship they need to have a statement from a person in the nursing home. And they did all this. The family got involved. They got the court system involved. And the Supreme Court from the state of Arkansas, remanded the lower courts by saying that this institution was not for the treatment of mental or nervous diseases. It was just simply a nursing home. So therefore, the whole thing was thrown out. The point here is that we have talked so many times on a radio and television show and saying that the laws are different from state to state, so pay attention. With that, I want to thank you, Cheryl, for being here, you, Kay, for being here, and I want to thank you, listener, for listening to us. Be with us next week. We'll be with you same time, same station. Have a great weekend. Bye-bye.
Helping Seniors with Joe Steckler, Thursdays at 1 p.m. on AM 1060 WMEL.